In this video, I'm going to be answering a question that I got asked recently. Which wrap is better when it comes to repair of hiatus hernia, partial or full? Let me give you a bit of a context. Whenever we do repair of hiatus hernias, and if you wish to know about what types of hiatus hernias I'm talking about, you can refer to one of my previous videos in which I've exactly explained what are the different types of hiatus hernias. Now, we repair hiatus hernia surgically using keyhole surgery. It involves 4 or 5 tiny cuts on the tummy, and what we do is we essentially bring down the stomach, and it has got 3 key steps. First thing is mobilization. The mobilization involves defining the gap in the muscle between where the diaphragmatic muscle is, whether it's a rolling hiatus hernia or a sliding hiatus hernia. After defining the muscle, we reduce it, which means we bring the contents down, which is the stomach in most instances, but in some instances it can be the large bowel and the small bowel as well if the hernia has been there for a long period of time. We bring it down into the abdomen carefully along with the sac. The sac is the hernia sac that has to come down as well, and we have to ensure that there is at least 2 to 3 centimeters of the esophagus in the abdomen that is comfortably resting. The third step is to then repair the gap in the muscle, either with stitches or using stitches and a mesh. And then the fourth step is to actually create what is called as a wrap, which is a fold of the stomach, which reinforces the function of the valve. The controversy is whether you should have a full wrap or a partial wrap. And that's what I will try and explain in this video. Before I get into the discussion about the wrap, I do want to say that this is a controversial topic. The topic of repair or fundoplication is something that really will depend on your surgeon's skill, expertise, experience, and how updated is he or she in relation to what is the best outcome for the individual. Also, there are a lot of individual or patient related factors. I will just share with you my opinion about it, but please do not treat it as a holy gospel, because as I said initially, there is a bit of gray area about it. Now, in my practice, there are certain things that go into the algorithm for us to decide whether an individual should have a total or a full or a 360-degree wrap, as I'm showing you in this picture, or a partial wrap, as I'm showing you in this picture. In a full wrap, as you can see, we actually create a full wrap of the stomach. The stomach fold goes all around the esophagus, whereas in the partial wrap, it is only the fold of stomach that is going either in the front or in the back of the stomach, of the esophagus, I should say. So the difference is that in a full 360-degree fundoplication, also called a Nissen fundoplication, it actually is associated with very good control of reflux, but the price that the patient has to pay is they get this syndrome called gas bloating syndrome. What it means is that when they have their meals, a bit of gas gets trapped in the upper part of the stomach, which is forming the wrap, and it creates a gas bloating sensation. It's like a bubble of air which is essentially stuck. They are unable to burp it out, which can be very uncomfortable for many individuals. Also, because their valve is now hyper functioning, or it is very well functioning, they are not able to burp that easily, they are passing more wind down the other end, which can be a bit embarrassing for some individuals. The partial wrap, on the other side, is something which provides a midway control. Besides the repair that has been done, it provides a midway reinforcement of the gastroesophageal junction, or the valve which is there. And what that means is it has got definitely less risk of the gas bloating syndrome, so people are still able to burp. So that's the first part of it. Secondly, it does not create so much of a hindrance on the muscle of the esophagus to push the foods down. What I mean by that is, in people who are older and are on many medications, the esophageal muscle becomes weak, and that leads to a condition called as esophageal dysmotility. And what that does is that if we repair and we create a full 360-degree wrap, it creates a lot of pressure in the lower part of the esophagus, and the food is not able to pass down smoothly, which can create difficulty in swallowing for some individuals. Partial wrap avoids that situation. The individuals are able to burp and food goes down relatively easily in comparison to a 360-degree or a Nissen's fundoplication. So I hope this video is informative enough. Of course, you just need to know about it. At the end of the day, it is your surgeon who's going to be the best person to inform you about what is the most suited wrap or fundoplication in your specific situation. Please understand the fundoplication is being done in combination with a hiatus hernia repair as well. So I hope you found this video informative. If you did, stay in touch by subscribing to my YouTube channel. Cheers.